Hey, James Sapirstein, of course, is the chairman, president, and CEO. I've been talking about him a bit today on First Wave Biopharma. One of my favorite people. He's just a good guy, and I get a chance to talk to him off the air quite often. Their stock symbol is FWBI. You can go to their website, which is firstwavebio.com. But I want to talk to him about a couple of things. What's going on with him because I know there's a number of things going on with the therapies, because the need for COVID therapeutics, so as not to depend solely on vaccines, has been a big issue of theirs. And of course, they've got some other therapies going on. But James, I have to tell you, I just had a discussion yesterday that I should get my second booster shot, which would be my fourth shot. Am I the only one thinking this? Because I think this is now becoming front and center for many Americans, as probably the world population, correct?
Correct. Yeah, and I know you like to say this, but people heard it on your show first.
Yeah.
Probably about 4 months ago, we talked about this, that the fourth booster was coming.
Yeah, that's right.
And yeah, I think that's going to be a strong recommendation for anybody over 50 or immunocompromised, that they need to get a fourth booster shot. Again, yeah, I had a talk with someone yesterday actually about the mask mandate that's been removed across the nation. And they asked me if I was comfortable with it. And I said, I think I'd be more comfortable if 90% of Americans were vaccinated. Then I think we can probably get rid of masks permanently.
You know, James, I have to ask you, with respect to that, it's been 6 months since my last vaccination, which is why I was bringing it up. And then the other thing is I just took a couple of days off over the weekend and was in Mexico, and I realized I had to take a COVID test before I can get back. I think we've all sort of forgotten, because it hasn't been front and center in the news for the last 3 months as much as it was before, kind of how important it is. But you were one of the first persons that talked about heading towards what's called an endemic. And I think the reason you were saying that was, look at you, you were never going to say this thing's going to ever go away, which was the bad news. The good news, at least it wasn't going to be a pandemic. It was going to turn to an endemic. Is it really come down to vaccination status at this point in your mind, or does it just come down to more research to see if we can lick this thing once and for all?
Absolutely, it's come down to vaccination status. In fact, the Biden administration, I believe yesterday, talked about putting more money into pharmaceutical therapeutics, which is the smart thing to do, and make the Pfizer and Merck drugs more available. But still, I mean, if you don't have the vaccine, quite frankly, those drugs aren't going to do much for you. The vaccines are helping to prevent death, plain and simple. Not sure why people are fighting this, but you need to be vaccinated. And these vaccines have been around for a while, and they're in several million people at this point. So I'm not sure what other evidence people need to see.
James, let's talk about First Wave Bio, because you guys have made a number of milestones, not just with COVID therapeutics, but your niclosamide that works with GI symptoms and such. Talk to us. Give us a State of the Union, and what are you looking most forward to for the rest of 2022 and beyond?
Well, we did do the COVID study. We should have a data readout fairly soon. We're waiting for our data lock to occur, and we'll put some news out on that soon. But we're really excited about ulcerative proctitis studies, which frankly is why we acquired the old First Wave Bio, the ability to help patients who have some severe GI disease. And we expect data on that this year. So some good things coming along the pipe. So, just stay tuned.
Yeah, and I think one of the things that I have to spend some time thinking about is the fact that you guys, there's these other maladies that are across the board. We talk COVID, and so on and so forth. But you guys are still marching down the field with the FDA and a number of other therapies. How is that going?
It's going well. I mean, we're considering filing a new IND for proctitis, but we're thinking how we might flip some of that data into ulcerative colitis. We have an open IND for checkpoint inhibitor colitis. There is excitement. Obviously, cash is king right now. The biotech market's under a lot of pressure. So these studies are probably going to be delayed a little bit so that we can make sure we can pay for them. But the data, from what we've seen is pretty encouraging.
I think for you guys also, if you think in terms of not just concentrating in one area, isn't that the key to biopharma these days? Because if you concentrate on one, you never know you roll the dice a little bit. I mean, your research is king, but you sort of have to realize that if you don't have more than one thing in the air, then it's obviously a little dicey at some point, correct?
Yeah, we talk about that all the time, which is multiple shots on goal. For the companies that have just one product, it makes life pretty difficult. It's a very binary type decision sometimes. So multiple shots on goal. If something doesn't work, or it works to the success rate that you want it to, you have something else that you can go to.
Thank you. His name is James Sapirstein. He's a friend of mine. He's a friend of yours, and he's a great resource to the program. And long story short, really our go-to guy for COVID. And I feel better sometimes. I feel worse sometimes talking to James. James Sapirstein, CEO of First Wave Biopharma. FWBI is a stock symbol.